Stroke kills nearly 129,000 people in the United States a year, and it is the leading cause of disability. 60% of stroke patients who die each year are women. As we observe National Stroke Month, we take a look at how women are affected. I'm joined by Dr. William Neal, who is a vascular neurologist at Kaiser Permanente. Dr. Neal, how well recognized are stroke symptoms, and what are they?
Yeah. Well, I think they're actually very under-recognized. I always give the equivalent of if somebody has chest pain, we pretty much all recognize that could be a major problem like a heart attack. With a stroke, it's a little bit different. The symptoms, I have an acronym that I like to use called BFAST, and it's the letters B-E-F-A-S-T. And I always tell people, any sudden difficulty with balance, eyes, face, arm, or speech, then it's time to call 911 because that could be a stroke. The biggest problem with stroke is that these symptoms are so under-recognized. We do have an effective treatment, but the treatment can only be given within about 3 to 4.5 hours. So by the time people realize maybe this is more than my arm fell asleep or I'm a little tongue-tied, it can be too late.
So 60% of the people who die each year from stroke are women. Is that because these symptoms that you just outlined are harder to detect in women?
There are a few different causes, so a few different reasons. On occasion, women will have a different type of stroke. There are two major types of stroke. One where you have a blood clot in a blood vessel to where you don't get enough blood flowing to the brain, and another type where you actually have bleeding into the brain. Women can be more prone to the type where you get bleeding into the brain, and this can be more severe, and it tends to be more fatal.
And what about, just offhand, when these symptoms aren't recognized, then treatment is delayed, correct?
Yeah, so if the symptoms are not recognized, and if somebody shows up maybe a day later, a couple hours later, and it's too late, the one treatment that we can offer becomes way too dangerous to give because it's a very strong blood thinner, or sometimes it'll involve a surgery. And if we wait too long, it causes more harm than good. So really, if people show up later, then we start to focus on recovery, meaning people will generally work with a speech therapist, a physical therapist, and a physical medicine doctor to get their arm strength better, to get them walking better, or to get their speech better. But it's a big problem if people show up too late. They don't have the opportunity then to get a medicine that can really make them better faster.
And what specifically is the treatment for stroke patients?
Yep. So there's one main one. The standard one is something called TPA. It's a very strong blood thinner. And we know that if we give it right away, there's a very good chance that the person suffering from a stroke can get better, occasionally make a full recovery without any problems whatsoever. If we wait a couple hours more, they have a decent chance of getting better and a higher risk of bleeding complications. And if we wait past 4.5 hours, the bleeding risk is too much, and we know that we really can't help them. Another option on occasion for some types of stroke is a surgery by which a physician will actually use a tube and a catheter to go through the arteries in the brain and actually pull out the clot. And then a third type of procedure is if somebody has a bleeding type of stroke, occasionally we can offer a brain surgery that can help minimize the bleeding and the swelling.
Very quickly, my mom had a stroke at the age of 54, and I found that her personality really changed. Is that common among stroke patients?
Yeah, this is one of the more under the radar things that can happen. The brain controls everything from seeing to walking to talking to doing mathematics, and it actually controls our personality. And we have seen that although somebody looks pretty good, hey, they're able to walk and talk and stuff like that, a lot of times personalities can change. A major problem after a stroke is depression. And we see a lot of that, and we see a lot of personality change.
And we have to close it there. Dr. Neal, thanks so much for coming on the program.
Thanks for having me.